What is diabetes mellitus type 1? It is when your immune system attacks and destroys insulin-producing beta cells of the pancreas with T helper 1 and 2 cells. This causes a decrease in the production of insulin, which causes blood glucose levels to rise. Due to the lack of insulin being able to mobilize the glucose molecules, this causes hyperglycemia. Diagnosis generally occurs in children and young adults.
Living with type 1 diabetes is very difficult, but with the help of the new technology from Dexcom, family and friends are able to assist patients with type 1 diabetes. A small sensor is placed under the skin and measures glucose levels throughout the day and night. Patients, friends, and family members may be alerted via phone or their app watch when glucose levels are high or low.
Here's a video of T cells, the purple dots, attacking the pancreatic islet, which are green. These pancreatic islets are the insulin-producing beta cells. Symptoms for type 1 diabetes start in juvenile or young adult, such as increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the hands or feet, sores that do not heal, and unexplained weight loss. Tests for type 1 diabetes include glycated hemoglobin A1C tests. These are used to establish if you are diabetic. These are also used to determine the average blood sugar level for the past 2 to 3 months. It measures the percentage of hemoglobin attached to the glucose. Once diagnosed with diabetes, a test for insulin cell autoantibodies is performed to establish type 1 versus type 2. This test uses immunofluorescence. If you have autoantibodies, then you have type 1 diabetes. There are over 50 plus genes that are in correlation with type 1 diabetes. The biggest genetic cause is IDDM1, with alleles DQB10201 and DQB10302 have the highest risk. This is what the structure of the IDDM1 molecule looks like. Other genes can code for type 1 diabetes as well, such as on chromosome 6 in a region called the HLA complex that's depicted here. A treatment for type 1 diabetes could be injected of modified swine insulin is one of these options. Human insulin and swine insulin only differ in one amino acid. This is an insulin produced from the exchange of a threonine amino acid on the human insulin on the left for the alanine at the end of the pig insulin on the right, as depicted here.
A glucose meter is a medical device used to measure the amount of glucose in the blood. The glucose in the blood reacts with an enzyme electrode that contains glucose oxidase. That enzyme is reoxidized with a media reagent, which is then reoxidized, creating an electric current. That electrical current is equal to the amount of glucose in the blood, giving an accurate reading.